Hello everybody. Good afternoon. We've nearly made it. One more talk, and it's about the best topic, dementia. A little bit of microbiome, but a lot of it has been said already. So I'd like to start by saying these are my opinions. I also wanted to just show you some images of the many dogs that take part in our studies. We have a longitudinal study of aging of the nervous system in pet dogs. We recruit in old dogs and we look at them every 6 months. We do a battery of cognitive tests. We look at their mobility. We look at their stability. We look at their body condition, body makeup. We do all kinds of things. Vision, hearing, smell, lots and lots of playing with these dogs. These dogs are a little bit self-selected because they all have to be food motivated and they all have to love us. But as you can see at them gazing out here, these are a fantastic crew of dogs. So that's an introduction to them. And so my declarations, I have no real conflict of interest for this study, I would say, this presentation. I'm funded by a variety of different companies and foundations and have 3 trials going on at this time. Can you all still hear me? Because the microphone just changed. No. Did it go off? Not too sure. Oh, there it is. We're back. All right, so we'll move on from the declarations. And what I hope to do in this session is to talk about canine cognitive dysfunction syndrome, how we diagnose it, some risk factors, and perhaps some ideas about treatment and things, and then try to link it to the microbiome, talk a bit more about the gut-brain axis and what this might mean for our patients. So I'm going to start by asking, what is cognition? Okay? So you need to think about that using your cognitive abilities. It is the mental action or process of acquiring knowledge and understanding through thought, experience, and the senses. You need that sensory input as well. That's really important. You can kind of talk about it as a set of mental abilities and processes related to knowledge, and it allows you to solve problems. It allows you to reason and make decisions. And it's a forebrain function. Us neurologists, we always have to localize things. This localizes to the forebrain, okay? What I found most amazing about this is we're all sitting here thinking, hearing, absorbing, and it's a whole series of cells with little electrical impulses that generates that. It is crazy. Anyway, moving on. I just wanted to talk briefly about behavior, because as we define cognitive decline and canine cognitive dysfunction syndrome, we're often asking about behaviors. And I work with a behaviorist, so all the time we're talking about this. But behavior is a response to stimuli and situations, so sensory information coming in, and it's a product of processing that sensory information and using your cognitive abilities. And it's also a forebrain function. Okay, so talking about cognitive impairment and canine cognitive dysfunction syndrome. So a little clarification here. Cognitive impairment, we're just saying cognition is getting worse. When we talk about canine cognitive dysfunction syndrome, we're talking about a particular constellation of changes. And the truth is, in many instances, we can't really definitively diagnose it early on. So we just say there's cognitive impairment or decline. But I want to show you one of the really simple tests that we do in a lab setting with these pet dogs, okay? It's called the sustained gaze test, and it's a test of attention. And what we're doing is simply asking a dog to sit if they can stand if they want to, but we're calling them to attention to a treat, and we hold the treat near our faces, and we're timing how long they maintain that gaze. Okay, it's a very, very simple test that we've been able to train owners to do and that we find correlates with many things. So here is a dog with severe cognitive impairment. This dog used to be able to do this test. She's 15 years old, but now the poor dear, she is not even understanding what's going on. So that's a complete and total failure, okay? That's a little bit like me early in the morning, a complete and total failure till I've had my caffeine. Then over here in the upper right, we have a dog who is on the task. Another Labrador. ready for that treat, will wait for that treat. I will tell you, young dogs can't do this test because they just jump on you. They just want to get the treat. But these older dogs, they will wait, and they will wait, and they will gaze and gaze. And then they get a little bit like, oh, come on, what kind of torture is this? How do I smile better? How do I get this treat? And ultimately, attention was broken, okay? But this dog is really performing very, very well. And then down at the bottom, we have a dog who is kind of in between. 15-year-old Labrador, wants the treat, oh, forgot the treat. Oh, now I remember again. So you can see how this discriminates with a very simple test. It's really a fantastic test. And just to show you how well this discriminates, I want to show you this slide. And honestly, this slide is like my worst nightmare. I always worry about my neurons. It's a secret that I'm sharing with you all. I worry about my neurons and how fast they're dying. This was a study we did looking at plasma levels of neurofilament. And neurofilament is an important structural protein in neurons. And when they die, it gets released and you can detect it in the blood. This is actually looking at neurofilament light chain using an ultra sensitive assay. And we looked at dogs from a very early age all the way to really elderly dogs, and you can see it goes up with age. Like, you're losing your neurons. They are dying at increasing speed. But if you then layer in diseases, neurodegenerative diseases, here we have dogs with cognitive impairment. Here we have dogs with degenerative myelopathy. That's a canine model of ALS. And then here we just have regular healthy old dogs who are doing great. And you can see that the trajectory of this curve takes off. And so that will allow us to document neuronal loss, and it correlates very well with that test, among others. So what's canine cognitive dysfunction syndrome? It's been mentioned a few times during the course of the day already. It is a constellation of neurobehavioral changes, and you can capture them with the DISHAL acronym. The D is for disorientation, and I'm going to show you this dog who is doing a little training test where she's learning to come and pick up a treat from under a cup, and she used to be able to do this fine. So she is a bit disorientated. She's also not paying attention. But she needs to learn this test, and she needs to remember it. Oops, she lost attention again there. She's not interacting in the same way. She knows to come, she's done this a lot, she knows to come up here, but she can't remember what she's meant to do. She's going to check out the wrong cup. No, it's the wrong cup. And so we do a lot of training of these dogs. We have some standard things that we do, and they very quickly learn. But we see as they develop this canine cognitive dysfunction syndrome, this all starts to decline. So we saw this dog was a bit disoriented. Owners will report changes in interaction with them and changes in the sleep-wake cycle, which is devastating for the owners as well. House soiling, another really problematic issue for owners. Changes in activity, and you see both increases and decreases. Unfortunately, the increases tend to be at night, and so that's problematic. And then we also recognize that many dogs get more anxious and that they have problems with learning and memory. So a little history on this. This is actually a topic about which a lot of work has been done, but not by veterinarians or neurologists. Well, not by neurologists, more by behaviorists. And so there was this amazing group in the 1980s and 90s, led by Carl Kottman, but Bill Milgram was a very important part of this group, and Liz Head, and they studied elderly beagles. And they realized that elderly beagles were showing cognitive decline. They trained them to do a lot of different cognitive tests that test different domains. So these were dogs that were trained all the time, and you could really do some quite clever, tricky tests with them. And they described the changes in those different domains. They also then started to do interventions, be it diet, be it environmental enrichment, or drug therapy, and were able to document those changes. So it was really very, very important work. And during the course of that work, they did enormous numbers of studies on what might be going on in the brain, and other groups have looked at this as well. So we know that there is chronic inflammation. We know there's mitochondrial dysfunction and altered glucose metabolism that was mentioned before. We know there's oxidative damage and excitotoxic damage as well, accumulation of amyloid, alterations in the astrocytes and the microglia and how they function, and vascular lesions as well. So we know there's this series of events that happen that really do mimic early Alzheimer's in people. And so from their behavioral testing, we can summarize really that dogs fell into three categories: those that successfully aged, those that had a mild cognitive impairment, and then those that had severe impairment, which they proposed was an early Alzheimer's disease model, and it became called the Canine Cognitive Dysfunction Syndrome. If you look at their brains on MRI, you can see pretty dramatic changes in terms of loss of neural tissue. So over here we have on the bottom a normal, and up here a dog with cognitive decline. And you can see that there's more space. These are the lateral ventricles, and they're much larger. And so you see loss particularly of frontal lobe volume and loss of hippocampal volume. And I can tell you we've now been following our dogs with repeat MRIs, and it is quite dramatic, the changes that we can see in terms of volume of brain tissue. If you look at the pathology, I think the most interesting thing to note is that you see amyloid deposition. And you see it really in the same patterns that you see in people with Alzheimer's disease. So it really is a great model of amyloid pathology. You don't see neurofibrillary tangles in the same way, but there certainly is phosphorylated tau present, and certainly there's a suggestion that some of these tau products are very, very toxic. So there is some tau story going on there as well. So ultimately, this work has led to still ongoing studies looking at different diets, different supplements, all kinds of different things performed by this group at a very high level, showing that you can influence cognition and cognitive decline in dogs as they age. Okay, but that was pretty much a lab animal setting. So what about pet dogs? And I think the first thing we need to address is how common is it? And this has also been mentioned. It's pretty common. We've got a few studies here, all that have been done by questionnaires from owners. Okay, and we'll talk a little bit more about the pros and cons of that as we go through. But what you can see is that as dogs age, here are a couple of studies that show 11 to 12 years of age. Here they've categorized as mild or severe. You've got about 30–40% of dogs showing changes. Then you get to 15 to 16, pretty much all of them are showing changes. In this study here, it wasn't quite as high, but 50% were showing changes. And then in this recent paper from the Dog Aging Project that really leveraged large numbers of dogs, they showed the hazards ratio increases by 52% with each year of age. Now, I will tell you, in our hands, we have been following our dogs very, very closely, doing all these fun tests with them, and we find no real change until we get to about 10 to 11 years of age. Then we start to see some little changes, but they tend to fall off a cliff by the time they get to 15, 16 years of age, and pretty much all of them are showing changes at that point. Okay, what are the risk factors? Overwhelmingly, age. Okay, age is the most important risk factor for cognitive decline, but then there are numerous things popping up in the literature from all kinds of different studies. The once daily feeding, not quite significant, but getting interesting. The quality of diet, that was a study out of Hungary. Activity levels, if you're more active, it's protective if you're a dog. Sensory decline. Now there's a nice questionnaire study on sensory decline. We've looked at hearing loss specifically. And over here, this is by doing hearing tests, brain stem auditory evoked responses. So we're really looking at their hearing. If we simply categorize hearing thresholds at 50, 70, and 90 decibels, we can see that once you get to that 90 decibel range, you've got mild, moderate, or severe cognitive impairment. Doesn't mean causality, but we know in people, hearing loss is a massive risk factor, and we also know that wearing hearing aids in people reverses that, suggesting that that sensory input is absolutely vital to your cognition. We were also able to show that so here I'm showing you the sustained gaze test, because I showed you a video, but there were other associations as well, that once you get to that poor hearing group, not only are owners saying that cognitively they're not performing as well, we can show that in the lab with our sustained gaze test. interestingly, sex and body size are not risk factors. And of course, there are a couple of different conflicting papers out about this, but I really personally thought that body size was going to be a massive risk factor. So that's been quite interesting. Age, time on earth is much more important. So how do you diagnose it? I think this is really problematic for us because it's very easy to say any older dog who's not behaving quite right has cognitive decline, and I think we need to be very careful about that. So first of all, there are owner questionnaires that are extremely well validated and out there and being used heavily. And so over here I've shown two of them, the CADIS questionnaire and the CCDR questionnaire, and again, very good work was done to validate both of these questionnaires. The CADIS one is much more sensitive to early changes. So if we're interested in trying to identify these animals earlier, that is a great questionnaire. The CCDR we're finding is more reliable when you look at it repeatedly. The problem with the CADIS one is it asks for frequency of events as much as once every 6 months, and people misremember that. So it's not quite as repeatable as the CCDR, but it's more sensitive early on. Here's another one from the Purina Institute going down the DISHA acronym. And again, owners grade the questions in these different areas, and ultimately the score will give you a normal, mild, moderate, or severe. So how do we use these questionnaires? And I really, really want to encourage everyone to use them as a screening tool only. They're a useful screening tool. They're also useful to monitor progress over time. But there are a lot of different comorbidities that could affect answers. So the one we see the most is urinary tract infections. That causes accidents in the house, for sure. If they have endocrine disease, developing Cushing's disease, or diabetes, we have a lot of accidents in the house. So that will really change them. Dogs with severe pain change their activity level and maybe also their anxiety level. And then, of course, vision and hearing loss becomes a very complicated question to ask, very hard to tease that one out. And then any other central nervous system disease. So if you use the questionnaire alone as a diagnostic test, you're doing yourself and your patients a disservice. It's a tool that allows us to help screen and follow patients. So how do we diagnose it? Well, really holistically, first of all, a really good medical history with that questionnaire. And then a very careful physical, orthopedic, and neurological examination. And on the neuro exam, we are not expecting to see any focal neurodeficits. Things should be diffuse. If you have something very focal, animals walking around in a circle just in one direction, we're worried that there is a focal lesion within the brain. We would always recommend doing blood work, CBC chemistry panel, always do a UA, and we always do a blood pressure right off the bat. And then, because I'm a neurologist, I want to do an MRI and a CSF tap. All right, I want to do that. Many of our owners do not want to do that. It's expensive, and there are certain risk factors associated with the anesthesia. So if you don't want to do an MRI, history and progression are everything. Okay, you really need to inspect that history and progression. You have to rule out systemic conditions, and identifying and then intervening with and treating pain is very important. I cannot tell you how many of the dogs come into our longitudinal study with, well, they're getting slow because they're getting a little bit old, and then we treat their osteoarthritis and they have a new dog. Okay, so everything changes. That's very important. And then, of course, the only neurological signs should be diffuse forebrain signs. How do you prevent it, delay it, or treat it? Well, obviously, if we could treat and cure canine cognitive dysfunction syndrome, we'd be treating Alzheimer's disease, and that would be a wonderful thing, so we're not there yet. But just little environmental things, so environmental modifications to promote activities of daily living. So here we have a runner, so the dog doesn't slip and fall over and get afraid and not want to move around anymore. Pain relief, regular outings for exercise and social stimulation. That's good for the dog, and it's good for the owner as well. There are all kinds of medications and supplements out there, and I don't really propose to go through each one of these. Obviously, the one that is best known is selegiline, which will increase dopamine levels and certainly is used quite widely. The patients I get to see, it doesn't really help. but the patients that general practitioners see much sooner, they do feel that there is much more of a benefit. And then we can talk diets, we can talk about anxiety and trying to modify anxiety. And if we have sleep issues, you can, of course, try melatonin or even a little Valium at night. But I just want to make an observation here. There is currently, I think we're at the start of a wave of papers coming out looking at different therapies for dementia in dogs. So we are nearly finished on a 60-dog placebo-controlled clinical trial, not on dementia, on other outcomes in general, but in this cohort of very elderly dogs. And I'd never done a trial in this particular population before, and there's not a lot out there in the literature about doing trials in this population. So these dogs are coming in, they get randomized at time 0 to one of 3 treatment arms, one's a placebo arm. We then look at them at 1 month, 3 months, 6 months, and we're certainly looking at cognition as well as other outcomes. And a large component of it is these client questionnaires. And what I have to say for you is we already know from our interim that the placebo effect with the owner questionnaires on dementia is massive. It is massive. It's somewhere between 30 and 50%. We haven't finished this trial yet. It's going to change a little bit. But even more interesting, it is maintained beyond 3 months. Now, the Alzheimer clinical trials, they have quite a finite placebo effect. This is long and maintained. So I think there's a couple of things going on here. One could be that we're all very optimistic and we want to see the best in our animals, and we're going to this effort with this trial and we're reporting great benefits. But the other could be that the interactions of the owner to have the dog take part in the trial and the dogs coming to our place and playing all these games, that could be improving them. And certainly in our longitudinal study, where the dogs are not a part of a treatment trial, these dogs are trying to get into the car to come in to the vet school in the morning because they love coming and spending a day of playtime. And I have never had that in a clinical trial before, okay? I've never had that before. So I caution you that open label studies can look at, they're pilot studies, they can look at safety, but be really wary about efficacy on these studies, okay? So diet is everything when it comes to the brain, probably in part because of the microbiome. So there are all kinds of diets that have been shown to impact aging in the lab animal setting. Antioxidants, omega-3 fatty acids, L-carnitine, medium-chain triglycerides. And in all trials on all of these substances, placebo-controlled trials, dogs have shown improvements on learning tasks relative to the controls. So diets are really important and really real. Okay, so I thought at this point you might be starting to fall asleep, so I just wanted to show you a case. This is a 15-year-old Labrador. And we have been seeing this dog, and her cognition's been going down for sure. But then the owner called me late at night because she had my phone number and going, oh my gosh, something's going on. And this is what was going on. Okay, so the dog started doing this. She would respond to the owner. She would get up and walk around. If she took her outside, this dog with terrible osteoarthritis, who had a really reduced activity usually, was just galloping round and round and round and round and round and round. She would stop if the owner went and interacted with her, and then she would start up again. And this was going on for long periods of time. The owner was a veterinarian. She'd treated with a benzodiazepine. It wasn't really having a significant effect, okay? So it's kind of interesting, isn't it? So the history of this dog, her main problem has been progressive loss of mobility, and she is managed very carefully with rehabilitation, non-steroidals and gabapentin. This dog is really carefully looked after. She's had an episode of vestibular disease 6 months previously, and she recovered. She's been kind of slowing down. She's had more and more urinary accidents in the home, and at night, sleep is very definitely disturbed. The owner also reports changes in interactions. But, systemically, other than a history of UTIs and her degenerative joint disease, she's pretty good, okay? Physical and neuro exam, we see our degenerative joint disease, we see sarcopenia, anxiety, a neuro exam that's essentially normal, but this is the dog that I showed you right at the start who could no longer do the sustained gaze task. She had mild deficits, but other than that, the major finding was she couldn't learn cognitive tests anymore. So we've got a dog who is abnormal at its baseline, but then we had this strange event. Was this a seizure? Was it the dog just having a really good day? Was it some other episodic alteration in cognition? We tried to make everything be a seizure, but not everything paroxysmal is a seizure. Either way, we need to look for systemic disease. We need to look for hypertension. We need to then ideally look in the brain for vascular events, brain tumors, etc., etc. So we're going to do a workup that will allow us to look at all of those things. Now, we didn't get all the way through the workup because the owner did not want to do an MRI, but we had some really interesting results anyway. So here on the blood work, we can see the dog has some kidney problems, and those have been coming along, but this was a little worse and had a low albumin. And then on the urinalysis, we see all kinds of white blood cells, bacteria, very dilute urine, suggestive a little bit more going on at the kidney level. And we grew Klebsiella out of this dog, quite resistant. It did have a history of a couple of UTIs before. So here I just wanted to take a sidebar and start talking a little bit about bacteria, because UTI and dementia is incredibly well documented association in elderly people, such that if you were the owner of an elderly parent, but that's the wrong language for that. If you have an elderly relative or friend, the minute there's anything a bit off, the doctor will want to check them for a UTI immediately. So there's a well-documented association. It's not so clearly documented in animals. There is a documentation with seizures that Dr. Volk's group has talked about, and I would attest to. But beyond that, it's not as well understood. Certainly, this could also be contributing to the urinary accidents. It's probably painful, impacting quality of life. Based on ultrasound and her specific gravity, we suspected she had pyelonephritis. We treated her and optimized her drugs for pain relief. And she had multiple of those events until we treated her. Those events went away. But her cognitive decline, of course, sadly, was not cured. So that is my little segue into the microbiome. And I don't know how many of you are microbiome researchers here. How many of you are really familiar with all the language? Some are really familiar, like if you are like me, not at all, okay? So, microbiome, what? There's two words, what's that about? So microbiota, it's the microorganisms, and the biome includes all of their genes, for example. And then I did a little microbiome project, consulting with lots of really good experts who led it. But the first thing they say to me is, do you want to do 16S or whole genome shotgun sequencing? And my answer is, I don't know, So anyway, it's important to understand a lot of the data that we're seeing is 16S, ribosomal DNA sequencing, that allows you to sequence this universally conserved gene region found in bacteria and identify the bacterial organisms from that. Whereas the shotgun sequencing gives you everything. It gives you fungi, it gives you absolutely everything. So it's a little different. Okay, that being said, I also just wanted to share my delight as I started to read all this literature in understanding that I was like a planet walking around with host to all of these different microorganisms. When you get up in the morning, you should say, how do I feel? Okay, how does everybody else feel? And also this means the Queen, and I guess I should now say the King, but that's going to take a little while for me. In England, the royal family refer to themselves as we. We are not amused, for example, but that royal we is correct. They are a we, we're all a we. So that is quite delightful to me. And the language around this I've enjoyed greatly. So this review paper from Barco et al. Refers to us and the dogs in this paper as multi-species hybrid organisms. And then Rob Dunn, if you want to read some very accessible science, he is a colleague at NC State in the College of Sciences, and he's a wonderful author. He refers to the Serengeti on our skin when he talks about the skin microbiome, for example. So I am going to jump across the next few things. You've heard in much better detail about the gut microbiota in dogs and how you can develop dysbiosis, and I'm now learning if you're very dysbiotic, that's really, really bad. I'm going to mention a little bit about the oral microbiota. So you can sample lots of different niches in the dog mouth, be it from mucosa, saliva, plaque, or the tongue, and they do have slightly different makeups, but they are quite stable until things go wrong. So the oral microbiota is quite interesting. And then I just kind of want to move on from there and say, well, we're saying that the gut microbiota could be linked to neurological disease. And so then our big question is, how could that possibly happen? And again, this has been addressed by previous speakers. The gut and the brain are linked, certainly by blood and by the vagus nerve, talking to the enteric nervous system. So we actually do have physical roots that can link the two. And then we absolutely can see changes in the gut microbiota that influence the immune response that influences the brain. We can see changes in endocrine pathways, and we can see the neural pathway in action. And I was going to talk about that a little, because I feel you've heard quite a lot already about the other things. One fact I wanted to point out here was I was not taught at vet school that 70 to 80% of the immune system is in the gut-associated lymphoid tissue. So it is incredibly important as an immune organ, and certainly changes in the entire immune response can be driven from the gut. We have heard about neuroactive substances, both good and bad. The one that I'm going to talk about a little bit are the ginger pains, which we haven't yet mentioned. And then I also wanted to just expand a little bit on that idea of the hippocampus and memory and gut microbiota. It has certainly been shown that the intestinal microbiota will affect memory in mice. And it has been shown that this has been mediated by brain-derived neurotrophic factor. Now, BDNF is a wonderful neurotrophic factor that helps with neurogenesis in the hippocampus, for example. And if you go out and exercise, you will boost your BDNF. So I recommend that everybody does that once we finish here. Very, very good thing to do. But, okay, I wanted to spend just a second talking about this. So I think Dr. Volk mentioned this, that you absolutely can have changes conveyed from the gut, or at least it's proposed you can, up to the brain. And here we're talking about pathologic proteins. Now, I think we're all quite comfortable with the fact that things like tetanus toxin and botulinum toxin and rabies can all get transported along nerves. Nerves have the most incredible transport systems within them. They have to have. They've got to get everything up and down these giant long processes. But I think perhaps the most convincing story that I have seen about how you might have changes in the gut triggering, precipitating, and influencing neurodegenerative changes in the brain comes with Parkinson's disease. So 50% of Parkinson's disease cases are preceded by constipation. So that seems to be really adding insult to injury. It really does. Now, we can make the observation that if you look at Parkinson's brains from histopathology, alpha-synuclein inclusions, also known as Lewy bodies, are absolutely pathognomonic. But you find these inclusions not only in the brain, but also in the enteric nervous system. Okay, and there was some question about, do they actually precede the inclusions in the brain? If you look at where the inclusions are in the brain as Parkinson's disease develops, you will find that they do, one of the first places they appear is the dorsal vagal nucleus. And then they spread from there. Patients with a truncal vagotomy, for different reasons, have a 50% reduction in their risk of Parkinson's disease. And so it is proposed that one of the components of Parkinson's disease is that these Lewy bodies, these synuclein fibrillar proteins, are transported up the vagus and then get disseminated across the brain. This also introduces, I think, another very important concept, and that is that a protein that's misfolded and misbehaving can encourage other proteins to misfold, misbehave, and propagate pathology. I think that's a really important concept that would not have been accepted 20 years ago. Okay, I am not going to say anything more about the HPA axis. I'm just going to mention briefly what we know about dogs and their gut microbiota and dementia, and this is pretty much it. Okay, so this one paper has already been described. This is a study where they looked at 29 dogs, aged from 3 to 13. They did behavioral tests in a very similar way to how we do them, and they sampled feces right after the behavioral testing. And one of their findings was that better memory performance was associated with a lower proportion of actinobacteria. Now, we have done a similar thing, but with a slightly different design, and we were not able to show this. We did not have the same findings. But rather than looking at dogs over a very wide age range, we just looked at very elderly dogs, so different study design. This, I think, is a little more interesting at the moment, and this is what's going on in the mouth. So we already heard earlier this morning from Dr. Creevy that dental disease is one of the most frequently reported problems by owners and by veterinarians. We also know that there's a study out there where owners filled out questionnaires quantifying the neurological problems. I think it was the CCDR, it could have been KDs. And then clinicians scored the dental disease, and there was a correlation between the severity of dental disease and cognitive decline. We also know this is true in people. So we had sampled the saliva and mucosa at the same time in 10 dogs, all greater than 10 years of age, 3 times at 6-month intervals. And what we found that was really interesting was every single dog over that time period had an increasing predominance of Porphyromonas species. So much so that actually when we took 3 main Porphyromonas species that we saw, it accounted for about 25% of all of the bacteria, which is kind of crazy. Now, in case you are not familiar with dental disease, Porphyromonas species are very important in mediating periodontal disease, but they also produce a protease called a gingerpain, and gingerpains are neurotoxic and are under a lot of investigation. There are clinical trials ongoing with Alzheimer's disease to see if they could be a component. And so blockading gingerpains can alter, in experimental models, can alter the changes going on in the brain. So that was really a very interesting observation that we now want to pursue further. So what does it mean? How do we decide about oral care? I will say that about half the dogs did get a dental during that period, and it made no difference to the predominance of the Porphyromonas species. So we're always in our elderly dogs balancing risk of anesthesia and whether we can influence the oral microbiome, but maybe we need to do dental care in a different way, like brushing dogs' teeth. I can say it's hard enough to get your children to brush your teeth, so dogs, for me, as maybe one too many. But there's also a very interesting line of drug therapy antagonizing gingerpains, and that will both influence the dental disease that's going on and in experimental models will influence the cognitive changes. So in summary, canine cognitive dysfunction syndrome is extremely common in elderly dogs, and it's a constellation of neurocognitive changes. Diagnosis should be made quite carefully. And beyond age, which is the most important risk factor, we need to think about activity, feeding frequency, body condition, hearing loss, things like that as risk factors. There's certainly some very there's plenty of evidence in other species and in humans that gut and oral microbiome contribute to neurodegenerative diseases through the gut-brain axis. And there is early evidence this might also be true in dogs. So I would like to leave you with a picture of our dear friends and acknowledge Dr. Jessing, who has funded the foundation that I work with, and show you a picture of the massive team that takes part in this. We have lots of different clinicians and scientists from across the vet school and from across different institutions as well. And I think, and there's a list of references. Thank you very much.